This is a birthday that, we have some reservations about celebrating.
It's been 5 years since the COVID-19 pandemic hit Quebec. On February 27, 2020, the first case of COVID-19 was reported in the province. Then on March 18th, the first death attributed to the virus. Quebec was shut down that month, quarantines, lockdowns, and later on curfews. The virus went on to claim the lives of over 10,000 Quebecers in the first year of the pandemic alone, and COVID-19 was ranked among the top 10 causes of death in the province.
We were ill prepared medically, scientifically, healthcare-wise, and I think as a society. In fact, one of the first cases in Quebec originated at a mass gathering wedding, and it really reminds us that, in retrospect, when the scientists and the public health experts are saying that we need to implement certain measures in place. If we don't, it can be catastrophic.
Infectious disease specialist Dr. Vinh says COVID-19 led to many advances and drawbacks scientifically.
We learned about this brand new virus at an exponential rate, translating some of this knowledge into developing vaccines. That was the beauty of the pandemic in terms of the scientific knowledge that we gained. The beast, however, is that despite all the elegant science and the translational aspect of the science, we somewhere went along the way and became 180 against science. We stopped listening to the scientific experts and the medical experts.
People try to minimize it in retrospect. I think a lot of people were scared, and they had good reason to be scared. Like, people were dying. Young, healthy people were dying, and nobody really knew what was going on. And there was a lot of misinformation.
Dr. Christopher Labos was at the forefront of disseminating information about COVID-19 in Montreal and even across the country.
In healthcare and out, it disrupted everybody's lives. It ruined a lot of lives, and it changed a lot of lives. We have to remember what the impacts of a pandemic are so that they don't repeat themselves, so that we have the preventative measures in place and that we continue putting money into research and development and public health.
A concrete plan like those created for natural disasters is what Dr. Labos says needs to be outlined. Quebec Public Health had promised a new provincial pandemic plan for this year.
When this happens again, we need to know what to do and who's going to be in charge of what, so that we don't repeat a lot of the inefficiencies that happened at the beginning of the pandemic.
In Montreal, Alyssia Rubertucci, City News.